Dr. Quinn, have you had many patients diagnosed with breast cancer?
Is there anything?
Oh no, Dr. Quinn can't hear us. Oh gosh.
Yep, I'm up now.
Okay, good. Okay, Dr. Quinn.
Uh-huh.
So,
I can hear you now. I'm sorry.
Okay, good. Dr. Quinn, tell us about the patients at your clinic. Have you had a lot of people come through diagnosed with breast cancer?
Yes, I have. And Jade, I want to tell you about two ladies. Both ladies were referred to the same surgeon with two different circumstances. The first lady came in, she was 58 years old, nurse, hadn't had a physical in over 10 years, but had excruciating back pain. Basically, we asked her to do a physical, and she did, and her right breast had a very large nodule. So we referred her to the surgeon. Now, to go to the second lady, she came in, she comes every year and gets a physical exam and a mammogram. She's 56. Long story short, the mammogram was abnormal. We referred her to the same surgeon. Her scenario was the cancer. She did have cancer, but it was diagnosed early and she was saved. But for the first lady, there was nothing that could be done because the cancer was diagnosed too late. It had spread all over her body to include her vertebrae, which resulted in the severe back pain, and she lost her life. So the lesson is get diagnosed early because it can save your life.
Sure can, Dr. Quinn. So what are healthcare experts predicting for breast cancer this year?
Well, I mean, according to the American Cancer Society, which I'm now a partner, breast cancer is the second leading cause of death for women in America, secondary to lung cancer. I mean, just to put it into perspective, in 2021, this year, it's being estimated that 281,000 women will be diagnosed with breast cancer. Now, also interestingly, 2,650 men will be diagnosed with breast cancer. So breast cancer is not just women, but it can occur in men. That's why men need to go to the doctor every year and be evaluated. But in regards to death, it's being reported that there's an estimated 44,000 people that will die from breast cancer this year in America, 43,000 being women and 530 being men. So it's so important that everybody get evaluated every year. But as far as mammogram...
Can you talk about the COVID pandemic and how that's affecting breast cancer?
Most definitely. I mean, basically with the COVID pandemic, there's reduced access to care. There's fear of infection, reallocation of healthcare resources, unemployment, people losing their insurance. This is resulting in people not getting screened early, later diagnosis, and in some cases, like our patient we talked about earlier, people losing their lives. So let's get the screenings done. Let's get these mammograms and follow the recommendations, and let's save some lives.
Yeah, let's don't let COVID stop you from getting screened. Thank you so much, Dr. Quinn, and we'll be right back.